So our next topic is grief reaction. Normal grief reaction is divided into 5 stages. The first stage of grief reaction is denial. Second is anger. Third is bargaining. Fourth is depression. And fifth one is acceptance. It should be noted that many patients will not go through all the 5 stages. Normal atypical grief reactions are more likely to occur in women, and if the death is sudden and unexpected. So if the death of the loved one is sudden and unexpected, and if the patient is a woman, then there is a possibility that abnormal or atypical grief reaction will occur. Other risk factors for normal grief reaction or grief reaction is problematic relationship before death of the, and if the patient has not much social support. So these factors can lead to a grief reaction. What are the features of atypical grief reactions? Features of atypical grief reactions is that the grief is sometimes delayed. Sometimes it can occur even after 2 weeks passes before the grieving begins. And prolonged grief is basically difficult to define, in which normal grief reaction may take up to and beyond 12 months. So usually the normal grief reaction, it persists for less than 6 months after a major life event. And the stages of a normal grief reaction, it include denial, anger, depression, bargaining, and acceptance. Now, a variant of normal grief reaction is adjustment disorder. Adjustment disorder and normal grief reaction are almost same. Normal grief reaction or adjustment disorder is a generalized term. It can be used if a person is unable to adjust to or cope with the stress after a major life event. So instead of the grief symptoms to get decreased, they increase with time. Basically, there is error in adjustment with the life routine. So that's why it is known as adjustment disorder. Remember that normal grief response or normal grief reaction is a subtype of adjustment disorder. Thus, you would be given either one of these, either adjustment disorder will be given or normal grief reaction will be given. So you can pick if any of one of them is given, as long as the duration is less than 6 months after the major life event. And if someone after a major life event is in denial or in anger or in depression, then it will be normal grief reaction or adjustment disorder. And if after a major life event, someone gets flashbacks, nightmares about that event, avoiding the people or situations or some circumstances that resemble that event or associated with that event, exaggerated startle response, sleep problems, irritability and difficulty concentrating, and feeling detached from surroundings, then you will label it as post-traumatic stress disorder. So after a major life event, if someone is in denial, anger, or depression, it will be normal grief reaction or adjustment disorder. And both of them persist for almost 6 months. So the duration will be less than 6 months. The duration of these symptoms will be less than 6 months. Someone after a major life event present to you with flashbacks, nightmares, keep avoiding people or situations that resemble or associated with that, even exaggerated startle response, sleep problems, etc., then you will label it as post-traumatic stress disorder. He is as long as it is less than 6 months, then it will be adjustment disorder or a subtype that is grief reaction. If the symptoms are for more than 6 months, then we'll label it as depression. If the feeling of, remember that normal grief reaction persists for 6 months. It is very rare that normal grief reaction may persist up to 12 months or more than 6 months. So in general, if the duration of the symptoms of the depression or the symptoms of feeling low after a major life event is less than 6 months, then it will be normal grief reaction or adjustment disorder. And if the duration of the symptoms after a major life event is more than 6 months, then we'll label or call it as depression. And if after major life event, the person has flashbacks and nightmares and sleep problems of that events or avoiding the people or situation that resemble that event, then we'll label it as post-traumatic stress disorder. So in short, after a major life event, a person can have normal grief reaction, adjustment disorder, post-traumatic stress disorder, or even the person can develop depression. So remember these four things whenever you see a history of major life event. And remember these differentiating points. I hope these differentiating points they are clear to everyone. Post-traumatic stress disorder, normal grief reaction, and adjustment disorder. Is there any question?
The post traumatic disorder, does it, like, if the grief reaction it lingers for more than 6 months, then it is post traumatic stress disorder?
No, the post-traumatic stress disorder, the time period is not specific.
Right.
You can see in normal grief reaction, the symptoms will be mainly denial, anger, and depression. There will be no flashbacks or nightmares or avoiding people or situation or circumstances that resemble or associated with the event. So flashbacks and nightmares of that event, this is specific for post-traumatic stress disorder. To make a diagnosis of post-traumatic stress disorder, you do not need to focus on the duration. That if it's less than 6 months, then it will be normal grief reaction. If it's more than 6 months, it will be post-traumatic stress disorder. No. If normal grief reaction persists beyond 6 months, then we'll label it as depression, because depression is a feature of normal grief reaction. In post-traumatic stress disorder, depression is not the main feature. The main feature is flashbacks and nightmares, and avoiding the situations or people that are resembling or associated with that event. Because with that event, there is a specific trauma associated. That's why the person will try to avoid situation that resembling those or that event. Any more questions? Now, the normal grief reaction, it persists beyond 6 months, then we will label it as, so after a major life event, a person is depressed. He has low mood, low interest in daily activities, self-neglect, low sleep, and the duration is less than 6 months, then we'll label it as adjustment disorder or normal grief reaction. While if the duration is more than 6 months, then we'll label it as depression. And we all know that depression can lead to pseudo dementia. Depression can lead to pseudo dementia. So this table will tell us how to differentiate between dementia, pseudo dementia due to depression, and grief response. Grief response is hard to define because everyone is different. The only point that you need to remember is that there are 5 stages of grief response and the symptoms persist for less than 6 months. While how to differentiate between dementia and pseudo dementia? The presentation of dementia and pseudo dementia is almost same. The only difference between these two is that the onset of dementia is, or true dementia is gradual in onset, while pseudo dementia is abrupt in onset. If asked questions to the patient, he or she would give wrong answers. So if you ask questions from a patient with dementia, he will give wrong answers. The answers will be wrong because a person with true dementia has poor attention and concentration and memory problems. While on the other hand, if you ask questions from a patient with pseudo dementia, he will say, I don't know, I can't be bothered, it's too difficult, I don't want to answer. So if he responds like that, then it is most likely pseudo dementia. And the other difference between these two is that patients with uh, pseudo dementia, they present to the hospital themselves because they have an insight to their disease. So they will present to your clinic or to the hospital themselves. While patient with dementia, they does not have an insight of their disease. So they will be presented by either police or their relatives. So these are the two important points on the basis of which you can differentiate between dementia and pseudo dementia due to depression. Now, some detail of post-traumatic stress disorder and its management. As we discussed that post-traumatic disorder has 4 types of features, that is re-experiencing, avoidance, hyperarousal, and emotional numbing. What is re-experiencing? Re-experiencing those traumatic events. There will be flashbacks and nightmares of those events, of that event, repetitive and distressing images that are related to that event. There will be avoidance of the people and situations. There will be hyperarousal. There will be hypervigilance for threat, exaggerated startle response, sleep problems, irritability, and difficulty in concentration due to hyperarousal. Emotional numbing, lack of ability to experience feelings and feeling detached. So emotional numbing is a feature of depression as well. So the thing that you need to focus in post-traumatic stress disorder is flashback, nightmares, and avoidance of the people, and hyperarousal. That is exaggerated startle response or hypervigilance for threat. And what other people will tell you about a patient with post-traumatic stress disorder, they will say that he is having anger, unexplained physical symptoms, and he is depressed, or he is using drug or alcohol. Now, the management of post-traumatic stress disorder is a little bit different from other conditions such as anxiety, stress, and depression. For the condition, we saw that the management was CBT and SSRI. while the management of post-traumatic stress disorder is a specific type of therapy that is known as trauma-focused cognitive behavioral therapy, or EMDR, eye movement desensitization and reprocessing therapy. So this EMDR therapy or trauma-focused CBT, this is specific for post-traumatic stress disorder. EMDR is a specific therapy that is used in the management of post-traumatic stress disorder. It is basically an 8-phase treatment method, which include history taking, client preparation, assessment, desensitization, installation body scan, closure, and re-evaluation of the treatment. So EMDR therapy consists of 8 phases. This is just for your knowledge, in which usually a focused approach to treating trauma and other symptoms by reconnecting the traumatized person in a safe and measured way to the images, self-thoughts, and emotions and body associations with the trauma, and allowing the natural healing powers of the brain to move towards adaptive resolution. So in EMDR, the person is basically reconnected with the traumatized event in a safe environment, and then he's allowed the natural healing power of the brain to move toward adaptive resolution of those situations. So the main management of post-traumatic stress disorder is trauma-focused CBT or eye movement desensitization and reprocessing or EMDR therapy. Remember that drug treatment for post-traumatic stress disorder should not be used as a routine first-line treatment for adults. The first-line treatment will always be trauma-focused CBT or EMDR. We have already discussed adjustment disorder. So in all other conditions, in anxiety, in depression, in panic disorders, or postnatal depression, initial line was CBT and antidepressants such as SSRI, while in case of post-traumatic stress disorder, trauma-focused CBT or EMDRs are the first line treatment, and then fluoxetine or mirtazapine or SSRI and atypical antidepressant, they can be used as a second line drug for the management of post-traumatic stress disorder. Let's do some examples of post-traumatic stress disorder. A 33-year-old female presents complaining of constant irritability when dealing with her small children, inability to concentrate, being easily distracted, poor sleep, nightmares of house fire. Her husband died in a house fire last year. So the first two lines does not give the diagnosis. Irritability when dealing with the children, inability to concentrate, being easily distracted, poor sleep. The only clue that give the diagnosis is nightmares. So flashbacks or nightmares, they are the main features of post-traumatic stress disorder. Trauma-based CBT or EMDR is the first line. If not in the options, then you will pick SSRI, such as fluoxetine, sertraline, or paroxetine, etc. Another example is a refugee always remember the war that occurred in his country. He sees his family members who were killed in that war. He has poor sleeps, so a refugee remember the war that occurred in his country, flashbacks of the war, flashback of the major traumatic event, and he also sees his family members who were killed in that war. He has poor sleeps and feels hopeless. He sometimes feels detached from his surroundings as he is watching the world on the roof of his room. So again, this is post-traumatic stress disorder, feeling of detachment. or numbness and flashbacks of the traumatic event, the diagnosis is post-traumatic stress disorder. Again, the treatment will be trauma-focused CBT or EMDR. So this was all about psychiatric disorder after a major life event, and it included normal grief reaction, adjustment disorder, post-traumatic stress disorder, and depression or pseudo dementia. So this was